reporting 204, but put an asterisk there, which is bringing Houston's total to 25,600. Sadly, the number of COVID-related deaths in the city of Houston increased by 1 to 245. The newly reported death is a Hispanic male in his 40s with underlying health conditions who passed away on May the 16th. Testing and the data show that more Hispanics are getting sick from COVID-19 and are accounting for a greater percentage of deaths. And as a reminder, the Houston Health Department this week launched a bilingual outreach campaign to inform Hispanics about measures that help stop the spread of COVID-19. The city is providing information and resources about free testing sites, and we want everyone to know that no one will be asked for your immigration status or for your documents at any of the free testing sites. And if you hear word that people are, please let us know, notify one of the council members, because the free testing sites are open to each and every one. The coronavirus is continuing to spread in our city, and collectively we have to do everything that we can, working together, in order to slow the progression of this virus. Late last night, the local health authority, Dr. David Pearce, wrote a letter to me and to Houston First, expressing his concerns about the 6,000 delegates for the GOP state convention scheduled to take place on July 16 through 18 at the George R. Brown Convention Center. The letter called the gathering a clear and present danger. And as mayor, I simply cannot ignore those words coming from Dr. Pearce, as well as other doctors that I've talked to or who have talked to me in reference to the gathering of this large number of people at this time. I know Dr. Peter Hotez has also been critical of large gatherings. And just today, Dr. Burt with the CDC has indicated that in states experiencing a surge, they need to return to phase one status, and to avoid any large indoor gatherings. So none of that can be ignored or disregarded. This morning, I asked the city attorney, Ron Lewis, and Houston First to review his contract with the State Republican Party of Texas. I have instructed HFC, the Houston First Corporation, to exercise its contractual rights to cancel the State Republican Party convention due to the pandemic. And then later on this afternoon at about 12, David Mintzberg, the chair of Houston First, also sent a letter to the State Executive Committee asking them to reconsider. That was sent at noon. And right around 3 o'clock, a little bit after 3, a letter has been sent to the Executive Committee of the State Republican Party by Houston First, signed by the President and the Chairman, canceling this convention. Look, these are some very serious times, and the public safety of the people attending the convention, the employees, their family members, the people in the city of Houston, the public health concerns are first and foremost, paramount. Those first responders, police, fire, municipal workers, all of the individuals who will be in contact or in close proximity to this indoor gathering, simply the public health concerns outweighed anything else. And so this decision is a decision to protect the health and safety of the employees, the delegates, and members of the public. Houston is a hotspot right now in a global pandemic, and we cannot have thousands of people gathering inside the George R. Brown. Houston looks forward to hosting conventions in the future when it is safe and we are not endangering people by exposing them to this virus. As we work to flatten the curve, we must continue to mask up, social distance, and then move forward. And if we work together, we can get that done. Now, at this point, let me call on Dr. David Pearce.
Thank you, Mayor. This is a very bad time, obviously. I think it's obvious to pretty much everyone. It's a very bad time to have a large gathering. The World Health Organization has been pointing out how we are not even, we're not at the peak yet. We see locally when we look at our numbers, there's no indication that we are at a peak. I would caution people that as we do approach a flattening of the curve, that our destiny is in our own hands. The actions that we take determine our future. We here in Texas flattened the curve a couple months ago. We did an excellent job of doing that. That undoubtedly saved people's lives. Today, we need to flatten the curve again. But once we start flattening that curve, we need to not make the mistake of allowing things to slip back and start re-engaging in those behaviors like large gatherings that would just set us back again and again and again. If we want the economy to get going, we need to wear a mask. If you want the schools to open, you need to physically distance yourself from others. If you want to have gatherings like we've had in the past, we need to figure out how to do that in safe manners. People's lives hang in the balance. We had another report of deaths today. And I've said, over the last couple of days, I've been reminding people that here today in Harris County, there are over 600 people that are in intensive care units. There's another 1,300 people that are admitted to the hospital with this disease. And those folks are seriously, seriously ill. And they all caught the virus from somebody else, certainly unintentionally or accidentally or however you want to describe it, but somebody else gave them the virus. We are in control of our destiny by acting responsibly as we interact with each other, wearing masks, keeping socially distant, physically distant, and not engaging in large gatherings.
Chief Pena.
Thank you, Mayor. Good afternoon. The number of firefighters in quarantine, we're still experiencing a high number of those in quarantine. We are looking better than we were a couple days ago. We are at 264 firefighters that are in quarantine. We've cleared about 40 through our infection control and medical direction process. So as of today, as of this moment, we have all our units in service. We are running 2 task forces that should be resolved within the next couple hours. And we're hoping to get additional firefighters clear quarantine and be available for work. I want to express my gratitude to our first responders, our firefighters, paramedics, who are out there taking extra shifts, doing the extra work to cover for those that are sidelined, and they're doing an amazing job for this community. In regards to complaints for the occupancy task force, we were at 48 in the last 48 hours. There were no referrals in the last 24 hours to TABC. So again, we appreciate the businesses in helping us gain compliance with the governor's executive order. One of the things that, as we deal with this pandemic and we encourage people to physical distance, what we don't want to do is for you all to ignore certain medical conditions that would otherwise warrant a trip to the emergency room, okay? If you're having a heart attack, signs of stroke, respiratory distress, call 911. That's what we're there for, okay? Anecdotally, we hear that some people may not be calling 911 or waiting because they're afraid to go to the hospital because they think that's where the virus is. Again, look, if you're having a heart attack, you're probably a lot safer at the emergency room than you are in your living room. So call 911. I encourage the community to use and make judicious use of the 911 system, okay? Use it for true emergencies, true medical, health, or safety emergencies. That's what we're there for. We have fully staffed ambulances and fire engines, and we're going to continue to do that in service of this community. So again, we encourage you all to, if you need 911 for a true medical emergency, call 911. That's what we're there for. Thank you, Mayor.
Thanks, Chief. Chief Acevedo.
Mayor, first and foremost, I want to say thank you. Thank you on behalf of the men and women of the Houston Police Department and our brothers and sisters at Houston Fire. And thank you, Dr. Pearce, for helping to make the decision to cancel the Republican convention. We We are under a lot of duress right now in our city in terms of the public health epidemic, and we also have violent crime we're trying to fight. And as of today, Mayor, we have a total of 223 members of our department that are in quarantine. 205 are police officers, 150 are positive with 55 pending results, and 18 civilians with 14 positive, 4 pending results. And you know, we're just so grateful that, I know it's a tough decision to make, but it's the right decision, and I'm hopeful that the Republican Party talks about law and order and how much they support the blue. We'll hear from the blue and the men and women on the front lines that it's the right thing to do, is to not to stack to the challenges we're facing in terms of the public health epidemic and the crime fighting that we're doing. We really believe this is a great move, and we just want to thank you, Mayor, for your leadership and for doing the right thing. Thank you very much.
Thanks, Chief. And as you know, the numbers are really reflecting themselves within the Hispanic community, and a part of what we're doing in addition to the PR campaign is to increase and provide additional testing. And let me call on Councilmember Gallegos to talk about an additional testing site that will be opening shortly. Councilmember Gallegos.
Thank you, Mayor. Like the Mayor stated, COVID-19 is impacting the Hispanic community heavily right now. As a matter of fact, this morning we lost a prominent Hispanic due to COVID-19. And I want to thank the Mayor. I want to thank Chancellor Maldonado, HCC Trustee Dr. Tamez, and Trustee Eva Laredo for working with UMMC in regards to opening HCC Felix Fraga campus in the East End. I understand it will be opening Monday, and that will be another testing site. So I encourage people to please go to the Felix Fraga campus. They're off of Navigation, since it will be a new testing site, which will help alleviate the long lines that we're having in HCC Southeast over there at Gulfgate. So this is just an extra testing site, and also to help the residents in Second Ward and Denver Harbor. So again, thank you, Mayor. Quiero decirles que este lunes van a abrir el site de Felix Fraga. Va a ser un lugar para hacer los tests del COVID-19. So va a comenzar este lunes. Ahorita tenemos el site que está Houston Community College Southeast, que está cerca del Gulfgate. Están haciendo los tests allí para el COVID-19, pero este lunes van a abrir el Felix Fraga ahí cerca de Navigation en el segundo barrio. Gracias.
Thanks, Councilmember. And as you know, there's the mass order, the requirement that's in place. And we've got the mass distribution. We also have food distribution. I know one of the food and mass distributions will take place in District J this coming weekend on Saturday. Let me call up Councilman Pollard.
Thank you, Mayor. We all know that this pandemic is affecting minority communities the most. I represent District J, which is Southwest Houston, Gulfton, Sharpstown, Westwood, Braeburn, Alief. Out of the top 10 zip codes, District J has 3 of the top 9. And so we're going to be making a concentrated effort to getting out in the community to the different community centers, the nonprofits, the apartment complexes, passing out PPE this weekend. There will be a special effort at the Peace Center, P-E-A-C-E, Peace Center, off of Bissonnette through the Higher Dimension Church, where we'll be having food distribution and PPE distributions on Saturday morning at 10 a.m. So if you're in the Westwood area, please come out. And for all the apartment complexes within District J, we plan to have a mass effort to come around to your property managers to pass out PPE to the complexes and the senior living facilities within Southwest Houston. Thank you.
Thank you very much. Now we'll take any questions that any of you may have.
Provision that's in the Houston First contract relating to pandemics that allowed you guys to cancel?
Thank you. Section 12 of the Terms and Conditions portion of the license agreement provides in pertinent part that either party may terminate the agreement or suspend its obligations due to force majeure to the extent that such occurrence is beyond the reasonable control of the party whose performance is affected. In the same section, the term force majeure is defined to include epidemics in the city of Houston specifically, as well as emergency governmental declarations and other occurrences of like nature. And that was put in March of this year. by the State Republican Executive Committee and Houston First.
Hey, can you talk to, why didn't you do this sooner? Were you trying to let were you hoping the Republican Party would cancel their own? Because now they sent out a statement earlier that said they're looking at all their legal options, and I mean, you think you guys can get sued, or, I mean,
well, the goal is that you try to allow parties and people to be responsible. You don't want to force anything on anyone. I'll give you several examples. The Pride event, the Pride Parade, the Gay and Lesbian Caucus, for example. They were scheduled to have their event the end of June. We spoke to them. They met with their board, and they voluntarily agreed, as you all know, to suspend their march and their rally. And they had a virtual Pride celebration. And literally every year, annually, hundreds of thousands of people attend that event. The Anime Masura event is held at the George Roy Brown every year. Spoke to them. They wrote a letter saying, based on the pandemic and their concern for their people who attend, as well as the Houston community as a whole, they were suspending their conference this year and would reschedule for next year. There have been many examples where people who are scheduled to have events, the Offshore Petroleum Technology Conference, CERAWeek, the World Petroleum Congress, all of them, by virtue of the pandemic and being very sensitive to the employees, the staff, their families, the Houston communities, they've voluntarily said no. And we joined in and thanked them for their efforts. No one wanted to make this to even appear to be political. This is a political convention, and the last thing you want to do in the midst of a pandemic is to politicize it or to make it seem as though you're going out of your way to close the door. And so you give people every opportunity in order to recognize what people are hearing every day on the televisions, reading every day in the newspaper, hearing from the medical professionals and the Texas Medical Association, 52,000 of them who sponsored this state Republican convention, wrote them a letter saying go virtual, and then withdrew their sponsorship. The Greater Houston Partnership, the business community, wrote a letter. Verizon, Comcast, their sponsors have written a letter saying go virtual. The Houston Chronicle today, in this editorial, Dr. Persh and the Houston Health Department have done everything they could to try to outline a series of things that could be done to make it safer, but then came to the conclusion that even if you did all of those things, it still would not prevent this convention from being a clear and present danger to the employees, to the delegates, to the people in Houston, to the cities and towns from which they come. No one wanted to step in and be the heavy and to say no, and then run the risk of being accused of being political. But if, after all of that, if you still refuse to recognize the public health danger to everyone involved, then I am still the mayor. And lastly, what was the linchpin for me is when one of the people on my staff, combined with my sister, who said to me, Mayor, brother, your mom was a maid working at these hotels. And if your mom was alive today, working at one of these hotels, would you as the mayor still allow this convention to go forth and run the risk of infecting your mom? And the answer is no. So you don't have to be my mom, okay? But I am the mayor of every single person in this city. And if you're not willing to step up and do the right thing, I am not going to divorce my responsibility and my job. We closed down the Houston Livestock Show and the rodeo, And this convention is no greater or better. And so the answer was, if you're not going to do it, I'm not going to abdicate my role as the mayor of this city to protect the health, safety, and welfare of every single person, including the least of people who don't have insurance and who need their jobs and who are on the front lines. So no, this convention is not moving forward, and it's because of the public health risk that it poses.
Mayor, what are your thoughts about the schools, the TEAs?
Look, these are our kids. Before we can talk about what's going to happen in August and September, shouldn't we be focused intentionally on trying to slow the progression of this virus in July? When our hospitals are running the risk of being overwhelmed, we're talking about what may happen in August or September with our kids and with parents. I think we need to do everything we can to get this virus under control today. And then we can see where we will be in August or September. And again, it's one thing when we can say, we're just going to send our kids back. They're younger kids. They're healthier. They're in a better position to withstand this virus. But they come from families and homes. They are teachers. They're janitors. They're people who are serving these kids meals. What about them? So I think this conversation is premature. And I think right now, when we're in the midst of this pandemic and the number of cases are rising, we should be intentionally focused in doing everything we can to blunt the progression of this virus, to gain some degree of control where we can manage it. So I'm not particularly thrilled about the conversation. I think the plan is highly premature and not well thought out, and there are too many unknown variables, and I think we are confusing the general public when we are trying to wrestle with this virus right now, and by focusing on something 2 months away, when the forest is on fire right now. So let's put the forest fire out, and then we'll have an opportunity to discuss what we do after the forest fire is out. But right now, the forest fire is blazing. It's blazing. So it doesn't really make a whole lot of sense to me to talk about what you're going to do when you haven't even taken this we haven't done everything we need to do at this point to put this fire out.
I think there are some people who made the argument saying, well, look, we had a 60,000 protest gathering of a lot of people, and that went out. You know, that's a gathering, this is a gathering.
And I've heard that several times. And what I've said, if people want to march from the George R. Brown to City Hall, that's your right. If you want to march outside, you can do that. That's your First Amendment right. You don't need a permit from me, and you can march. That's an outdoor event, go for it. But it's a different thing when you're talking about an indoor convention, 2 to 3 days, where people are in close proximity every single day, most of the day, okay? That is a different deal. But if people want to march from the George R. Brown, from Discovery Green to City Hall, you can do that. Dr. Percy, you want to address that? Because I've heard that several times.
So when it's an indoor event, it's clearly a different environment. When it's a 3-day event, it's clearly different from a several-hour event. Now, that's not to say that the march is not without risk, and that's why we worked with the organizers of those marches that had organizers to encourage them to have masks available and be offered masks and stuff to try to make it as safe as possible. But from my standpoint as a public health authority, I can't stop a protest on city streets. I can't write a control order to stop that because of the way the law is written. So, any thoughts that I should have taken action at that point, that the law just doesn't allow me to do. It's just not practical. If I had written an order that thou shalt not gather at the Discovery Green, they would have said, okay, then we're going to walk down Walker Street. Okay, so then, okay, now you can't be on Walker Street. Okay, we're going to go over to Lamar. I mean, it just becomes a ridiculous, paper chase, and you can't do it. So there was no real way for me as a public health authority to do anything about it. But we did work with the organizers to do what we could to make those marches as safe as possible. And I think everyone there knew that they were taking a bit of a risk in doing that. Just like even the convention goers, I would like to think that they would know that the mayor's actually done them a great favor by eliminating the risk that they would take by being at that convention. I understand they have a different opinion, but he really has eliminated a serious risk for them.
And Mara, please understand, when people are marching or demonstrating, they are walking, they are moving. Nobody is making their breakfast or serving them. Nobody is making or serving them lunch or making and serving them dinner. Nobody is making up their beds and cleaning their rooms. There are distinct differences between marching and protesting. If you want to go and march and protest, you are assuming that responsibility for yourself as well as those around you, too. But when you are in an indoor event, like a conference, it requires ancillary support. So you are involuntarily including other people in order to facilitate that event. That's the difference. And Dr. Birch, in her comments, Dr. Birch specifically focused on on indoor events. That's what she said. That they are simply saying you should not have these indoor gatherings in any large numbers. So there are distinct differences. And, but, people will try to justify their position based on what happened.
Mayor, there's a report saying United may have to potentially furlough some employees by October 1st. How will this potential ripple affect the city and the businesses?
Say the first part again.
There's a report that United may have to potentially furlough frontline workers by October 1st. Does that affect the city of Houston as a...
I have not heard that as of yet. I don't know if the possibility is there. I know we've done what we can as a city and city council to provide them with some additional financial relief. I know they've received some additional relief from the federal government, from Congress. I know more people are flying today than before. So I don't know the details, so it's very difficult for me to speak to that.
And a question for Dr. Birch. Vice President Pence says he is reissuing renewed guidance on preservation and reuse of PPE in the state of Texas. Are Houston hospitals running low on PPE?
Good question. So right now, the hospitals are not low on PPE. They are monitoring it very carefully. And we do have, through SETRAC, we do have an option for healthcare providers to have some of their PPE to be re-sterilized so that it's reusable. But even a mask can only be reused so many times because the elastic wears out and things like that. But we do have contingency plans, not contingency. We have plans that were actually being used right now to recycle some PPE. And if the situation doesn't get better, my fear is that we're going to wind up into a PPE shortage yet again that we were in a few months back. And that, again, that is another complication which is completely avoidable if we wear our masks, remain physically distant, and don't have large gatherings. And wash your hands and clean the commonly touched surfaces. You know the drill.
Mayor, I just had a question. Some folks noticed there were some COVID teams out at the homeless camps,
Yes.
cleaning them up and stuff. Can you talk about, is that part of the initiative you guys
Yes.
announced last week? And where are they going? Because we're actually seeing that in real
Yes,
life.
in fact, we have specific teams, COVID, homeless teams. You'll see some trucks that says COVID, homeless COVID initiatives, and they are going from one location to another, cleaning these homeless camps up. And then that will segue into the $65 million homeless initiative with the city and the county, where the goal is to house 5,000 homeless persons over the next 2 years. So that is a part of our homeless initiative with the county, the city, but specifically focus on cleaning up these encampments and other areas throughout the city, and then housing those who are homeless with wraparound supportive services.
So they're actually taking them to housing, like, I guess right now?
Providing homes, rental assistance, permanent supportive housing, cleaning up these encampments as we make that transition. Our hope is that we can house as many. We are saying 5,000 between now and, let's say, the end of the year. Hopefully people will see a noticeable difference. That's our hope. But it's the first time that the county and the city are working at this scale and being singularly focused on reducing homelessness within our region. So it's not just Houston, but it's Houston-Harris County. And I can't thank County Judge Lena Hidalgo, the commissioners, and city council members, Mark Eichenbaum, and Eakin have all provided leadership to this initiative.
And we had, and wanted to know, maybe Councilmember Gallegos can tell us, who was the prominent Hispanic committee member who died of COVID? Can you expound on that, please?
It was Joe Gonzalez, the owner of Mamacita's Restaurants in El Jardín in the East End.
Has he been sick for a while, or?
I don't have the details. I just know he passed away this morning.
Maybe we just have one more question.
Yeah, and he's Dr. Lauro Murillo's brother from the Hispanic Chamber.
In fact, I got a word from Dr. Murillo this morning that her brother passed, so I certainly want to extend our wishes and condolences and our prayers to Dr. Laura Murillo and to her entire family. You know, these are tough, challenging times for everyone, and so and these are people that we know, that we love, so we certainly want to wrap our arms around this family. Okay.
May I have a question for Chief Peña in Spanish?
Oh, sure. You want him to talk in Spanish?
You got it?
Well, yeah, I don't want to hog the show, so Chief.
Chief Peña,
Yes.
hablaste sobre el incremento, bueno, sobre las llamadas del 911.
Sí.
¿Qué piensas de los casos que han subido de gente falleciendo en casa y cuándo es propiamente para hablar al 911?
Sí, mire, lo que comuniqué hace unos minutos es que las personas que sientan síntomas de ataque al corazón, de respiración, de problemas con la respiración, que no teman llamar al 911, que no se esperen mucho. Muchas de las personas, lo que hemos oído, y sin verificar ciertamente, es que esperan a llamar al 911 porque temen ir al hospital, porque creen que ahí es donde se pueden contaminar. Esa no es verdad. Lo que nosotros estamos pidiendo a la comunidad es que usen el 911 responsablemente, ¿sí? Si son problemas de emergencia críticos, médicos o de seguridad, que llamen al 911, para eso estamos. No esperen. Muchas personas esperan mucho tiempo para llamar, especialmente si tienen problemas cardíacos o si tienen problemas de respiración, y muchas veces eso es muy tarde, ¿sí? Cuando llaman al 911. Nosotros queremos que si tienen problemas médicos, emergencias graves, médicas o de seguridad, que llamen al 911. Para eso estamos. Tenemos todas las unidades, las ambulancias en servicio, tenemos las trocas de bombero en servicio y estamos disponibles para responder a su emergencia.
Rápidamente.
Is it something that you might want to share in English as well, or have you already covered it in English?
I did.
Okay,
Uh-huh.
thank you.
Rápidamente, Chief Peña. La comunidad hispana se ha oído en las actualizaciones que ha estado siendo más afectada últimamente
Sí.
en este lugar de Houston.
Sí, la comunidad hispana, la comunidad afroamericana, ha sido impactada más, ciertamente, del coronavirus y por varias razones, ¿verdad?, médicas. Pero por eso quiero estresar que si tienen necesidad de llamar al 911 para una emergencia, que no se esperen. Para eso estamos el Departamento de Bomberos y el Departamento de Policía. listos para responder. Tenemos todas nuestras unidades listas para responder. Las ambulancias están en servicio y las trocas de bomberos están en servicio. El departamento de policía también está listo para responder. No se esperen, especialmente si es problema cardíaco o si es problema de respiración.
¿Han tenido ustedes alguna llamada que tienen miedo a su estatus legal?
No, nosotros, mire, estamos tomando todas las precauciones para los bomberos para proteger la seguridad de los bomberos y de los pacientes que estamos atendiendo, ¿sí? Tenemos todo el equipo de protección, tenemos todas las órdenes van en pie y estamos manteniendo el servicio que necesitan los bomberos para poder proteger a esta comunidad. Sí tenemos más precaución cuando estamos llegando a la escena, pero el tratamiento va a ser igual. Sí, señor.
Chief Acevedo, did you have anything to say about the Twitter tiff between you and the council member?
He's going to take questions after.
Okay.
We're not going to deal with that right now.
You know, while Chief Pena was speaking, you know, I'm going to have to get me some new tapes. Tapes that I got are just not working.
Tutoring session, Mayor.
Any other questions?
Not COVID related, and the chief will be around if he wants to speak to media on other issues.
I gotta go do it. Can he talk about it on the microphone? So it'd be easier for us all to get?
That's up to the chief. We're done. We're done.
El finish, el terminado.
All right, the mayor wrapping up there with a lighthearted moment and some laughter, but you heard earlier during that press conference there, you heard a mayor impassioned and on the verge of getting emotional as he talked about not only the latest numbers here, but when he got into the reason behind canceling the city's cancellation of the Republican State Convention at the GRB coming up here next week. The mayor saying that it just is not smart to put 6,000 delegates and all those GRB workers inside of buildings in an enclosed space during this pandemic. So the mayor asked them to go virtual and reschedule, and today he sent a letter telling them that the city was canceling that convention scheduled to start on the 16th. Also noteworthy, I think, in this press conference, the mayor today saying that he thinks the talk about how to send kids back to school in the fall is premature. As he put it, the forest is on fire. Let's worry about what to do after that once the fire is out. He called the plan that's being discussed by the TEA and the White House as well. He said it was not well thought out. There were too many unknowns, and in his view, that was confusing parents and teachers as these plans get out there, but then districts are told to do what you think is best, even though these guidelines have been released. So the mayor there with some definite opinions on what's happening with this pandemic and what's happening in the city of Houston right now, something we don't often see, but today impassioned and emotional as he discussed his thoughts on those two subjects. We have the 411 coming up for you here. We'll wrap all this up for you. That's about 13 minutes away, 12 minutes away.